Hello everyone. Today we'll discuss about the structures at the back. Now first of all, this is the view of the back muscles and the back structures. Now the muscle will actually connect the upper limb with the vertebral column are mainly these five. These five must actually connect the upper limb with the vertebral column in the center. Now first of all, this is the trapezius muscle. This is the trapezius muscle. The latissimus dorsi muscle, it will be present somewhere over here. Then the levator scapulae muscle. This is the levator scapulae muscle. This is the rhomboides minor and this is the rhomboides major. Now, first of all, trapezius muscle, it is made developed from the brachial arch of the mesoderm, same as that of the sternocleidomastoid muscle, and that's why both this muscle, as because they develop from the same brachial arch mesoderm, they both are supplied by the same nerve known as the spinal accessory nerve, cranial number 11th nerve. Now, the origin of the trapezius muscle. As over here, as you can see, this hole is the origin, and at the side this will be the insertion. So the hole is the origin. That means first of all, in the over here in the external occipital protuberance of the skull, then a superior knuckle line. As you can see, this is the superior knuckle line at the sides of the external occipital protuberance. So at the external occipital protuberance, then superior knuckle lines, especially the medial 1/3 of the superior knuckle line. Then the ligamentum nuke. This is the ligamentum nuke. Then the spine of C7th vertebra, and from T1 to T12th vertebra. Okay, that means external occipital protuberance, superior knuckle lines, medial 1/3 area, ligamentum nuke, then the C7th spine vertebral column, then the T1 to T12 vertebral column. The ligament, also known as supraspinous ligament. Now the insertion, it has mainly three fibers: upper, middle, and the lower fibers. Now first of all, the upper fibers. The upper fibers are mainly attached, remember, to the posterior border of the lateral 1/3 of the clavicle. It is not seen over here, it is hidden, but remember it is mainly present at the clavicle, posterior border, lateral 1/3 of the clavicular bone. Now the middle fibers. As you can see, the middle fibers over here are mainly attached to the scapula, and particularly in the scapula, mainly attached to the this acromion process. As you can see, the acromion process, and the upper lip of the crest of spine. This is the crest of spine. So at the upper border of crest of spine, so acromion process and the upper border of crest of spine. Lower fibers are this one, and they are mainly attached to the triangular area or the apex of the triangular area. As you can see, the apex of triangular area at the medial end of the spine with the bursa intervening. Now nerve supply of this, it is mainly two nerve supplies, motor and the proprioceptive. The motor supply is mainly the spinal part of accessory nerve, and the proprioceptive is the branches from the C3 and C4 cervical nerves. Now the structures under cover of trapezius muscle. Various structures, as you can see in this diagram, this is the trapezius muscle. And when I will remove this muscle, okay, I will be able to see this much muscles, some nerves, vessels, okay, and bursa also. So first of all, we have under cover around 10 muscles under this trapezius muscles. Now which are these? These are mainly 10. First of all, let's start from the upper side. It is the semispinalis capitalis. This one is the semispinalis capitalis over here. Then the splenius capitalis. This is the splenius capitalis. The levator scapulae muscles. Then the inferior belly of omohyoid. This is mainly present. This is actually the muscle of the neck. It is also present under cover of this only, inferior belly of omohyoid. And the rhomboides minor, as you can see over here, and the rhomboides major. Remember, rhomboides minor is present above the rhomboides major muscle. Then the supraspinatus. This is supraspinatus muscle above the spine of scapula attachment. Okay, and the infraspinatus below this spine. So supraspinatus, infraspinatus. Then the latissimus dorsi muscle. Last is the serratus posterior superior over here, under cover of rhomboides minor and rhomboides major. So 10 muscles: semispinalis capitalis, splenus capitalis, levator scapulae. Then the neck muscle known as the inferior belly of omohyoid, then supraspinatus, infraspinatus, rhomboides minor, rhomboides major, latissimus dorsi muscle, and the serratus posterior superior muscle under cover of trapezius muscle. Now the vessel under cover of trapezius are, remember, transverse cervical arteries, superficial and deep branch. Transverse cervical artery is actually a branch of thyrocervical trunk, or arises from thyrocervical trunk. Okay, and both superficial and the deep branches of transverse cervical artery is present under cover of trapezius. Remember, superficial transverse cervical artery is also known as superficial cervical artery, and accompanying vein also will be present under this. And the deep branch of transverse cervical artery is also known as dorsal scapular artery. Okay, and its accompanying vein also. And the last is the suprascapular vessels, also present under cover of this. Now the nerves. Nerves are the spinal root of accessory nerve. Okay, now if you remember, this nerve only supplies the motor part of the nerve supply of this trapezius muscle. So it is also present under cover of this muscle. So spinal root of accessory nerve, then the suprascapular nerve. So remember, suprascapular nerve and artery both are present. And the C3 and C4, if you remember, C3 and C4 actually supplies the proprioceptive supply of this muscle. So C3 and C4 also. And the posterior primary rami of C2 to C6 and T1 to T12 pierces the muscle to become the cutaneous nerves. And a bursa also. A bursa lies over the smooth triangular area at the root of the spine of scapula, means somewhere over here. Okay, it represents the bursa over here somewhere. Now next is the actions of the trapezius muscle. Now if I told you before, it has made 3 fibers, upper, middle and lower. So upper fiber mainly act with the levator scapulae muscle. Levator scapulae is over here. This is the levator scapulae. So this trapezius muscle along with the levator scapulae muscle, it will actually cause the elevation of the scapula. It will cause the elevation of the scapula, as in shrugging your shoulders. Okay, so when you shrug your shoulders, the upper fiber of trapezius muscle and levator scapulae acts together. And the middle fiber of trapezius muscle act with the rhomboid muscle. Rhomboid muscle means this one. This rhomboid is minor and major and will cause the retraction of the scapula. And the upper and the lower fiber together, acting along with the serratus anterior, it actually rotates the scapula forward round the chest wall. Now the latissimus dorsi muscle. Before going this, we will discuss about the important things about the latissimus dorsi muscle. Now the main features of the latissimus dorsi muscle are, this is the only muscle which connects the pelvic girdle and the vertebral column to the upper limb. Pelvic girdle and the vertebral column of the upper limb. It mainly develops from the extensor compartment of the limb, of the lower limb. It is developed from the extensor compartment of the lower limb, but then after its development, this latissimus dorsi migrates to the wide attachment on the trunk and takes its nerve supply, thoracodorsal nerve along with it. The latissimus dorsi is tested clinically by feeling the contraction or the contracting muscle in the posterior fold of axilla and asking the patient to cough. So when the patient is asked to cough, you have to check the posterior fold of axilla on the axilla of the patient. Now the origin of the latissimus dorsi muscle. As you can see, this is the latissimus dorsi muscle and it is originated from the outer lip of the posterior one-third of the iliac crest, then from the lumbar fascia, and so because of this, it mainly attaches the muscle to the lumbar and the sacral spine. Then the spine of T7 to T12, thoracic vertebra and the lower 4 ribs and the inferior angle of scapula. As you can see, inferior angle of scapula. So iliac crest, lumbar fascia, T7 to T12 thoracic spines and the lower 4 ribs and the inferior angle of scapula, and insertion from the floor of bicipital groove of the humerus. As you can see, from the bicipital groove of the humerus, as you can see over here. Now the thoracodorsal nerve is the nerve supply of this. Okay, and the root value is C6 to C8, thoracodorsal nerve. Now its action very important. It is known as the climbing muscle. Why? Because it extends, adducts and medially rotates the shoulder, as in swimming, rowing, climbing, pulling, folding the arm behind the back and scratching the opposite scapula. So also known as the climbing muscle, and also helps in raising of the trunk above the arm, and also helps in violent expiratory effort like coughing and sneezing. So mainly for climbing, and also helps in expiratory processes or the violent expiratory efforts like coughing and sneezing. Now very important, it is also form the boundaries of the various triangle at the back. We have mainly 2 triangles at the back, that is a triangle of lumbar triangle of Petit and the auscultative triangle. We'll discuss about this in the end of this video. Now the levator scapulae muscle, as the name says, levator scapulae, that means it will elevate the scapula. Okay, and as you can see over here, it is mainly attached to the scapula and also the vertebral column. So origin of it is mainly from the posterior tubercle of the transverse process of C1 to C4 and insertion at the superior angle and the upper part of the medial border of the scapula. And the nerve supply of it is a branch from the dorsal scapular nerve C5, root value is C5, and the C3 and C4 branch are proprioceptive. So remember, its origin from the C1 to C4. Okay, and the branches for nerve supply is mainly C3 and C4 for proprioceptive, and C5 dorsal scapular nerve also supplies it as a nerve supply. Now the action, it helps in the elevation of the scapula and also steadies the scapula. Now the rhomboidus minor and major, very easy. As you can see, rhomboidus minor is this one and rhomboidus major. Now as you can see, the rhomboidus minor mainly originated from the spinous process of the C7 and T1 vertebral column, C7 and T1, while the major is mainly attached to the spinous process of T2 to T5. So C7 to T5 is the whole rhomboidus muscle, C7 to T1 minor, T2 to T5 are the major. And insertion, as you can see, insertion is this one. Lateral is the insertion, medial is the origin. So laterally, minor may attach the root of the spine of the scapula. The spine of the scapula is this one and root of this. And the major between the root of the spine of scapula and the inferior angle of the scapula. Okay, it's very easy. Now the nerve supply, it is a dorsal scapular nerve, C5, root value is C5. And the action is the retraction of the scapula. And if you remember, I told you in the trapezius muscle that along with the middle fiber trapezius muscle, this rhomboidus actually causes retraction of the shoulder and the scapula. Now the very important triangles of the back. We have mainly two triangles in the back, that is the triangle of auscultation and the triangle or the lumbar triangle of Petit. Okay, now over here, as you can see, this is the triangle of auscultation. Okay, and over here, the medial border of the triangle is mainly formed by the lateral border of trapezius muscle. Lateral border of triangle is mainly formed by the medial border of scapula and also some part of the inferior angle of the scapula. And the inferior part of the triangle is mainly formed by the upper border latissimus dorsi muscle. So trapezius muscle, scapula, medial border, the inferior angle, and the latissimus dorsi muscle. Now over here, very important, the floor of the triangle is mainly formed by, remember, 6th and the 7th rib and the 6th intercostal space and the rhomboid major muscle also. This is the only part of the back which is not covered by big muscle, and that's why over here auscultation is done very easily and well. So respiratory sound of apex of the lower lobe heard through a stethoscope are better heard over this triangle on each side. So remember, we mainly hear the sound of the lower lobe, sound of the apex of the lower lobe of the lungs. On the left side especially, the cardiac orifice of the stomach lies deep to this triangle, and as because of the cardiac orifice present over here, so in the previous days when X-rays were not discovered, the sounds of the swallowed liquids were auscultated over in this triangle only to confirm the esophageal tumors. Now the very important lumbar triangle of Petit, as you can see over, it is mainly formed on the medial border by the lateral border of latissimus dorsi muscle. Medial border of it is mainly formed by latissimus dorsi muscle. This one, the latissimus dorsi muscle. Then laterally by the posterior border of external oblique muscle of the abdomen. So over here, as you can see, this is the external oblique muscle of the abdomen. So it forms the lateral boundary of this. Okay, and inferiorly by the iliac crest. This is the iliac crest. So medially by latissimus dorsi, laterally by the external abdominal oblique muscles, and inferiorly by the iliac crest. And remember, its floor is mainly formed by the quadratus lumborum muscle. And remember, the occasional hernia at this side is known as the lumbar hernia, potential site for lumbar hernia. So this was all about the structures and the muscles at the back. Hope you understood it well. Thank you so much.